Hello, my name is Alyssa Jimenez, and this is my Nursing 335 Leadership Clinical Reflection video. In this video, I'll be covering how I met the 8 objectives of the course throughout this fall semester. So, objective number 1 is utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. So, I've done this throughout the semester. I think the first time I've done this is probably the community blood pressure drive. So this was a health ministry drive with Doris Farrar at a local church where I got to practice my skills of taking manual blood pressures, and I actually thought this was very rewarding. It was great to do patient education teaching as well. I got to teach patients, to cut back on things like caffeine and sodium for people that had high blood pressures, and it was nice to let people know where they stand, like actively go in the community and feel like you're making a difference. Another time that I feel like I did this was also practicing my skills with injections at the Cedar Crest flu drive with Professor Batchelor. So I got to practice my IM injection skills, which was great. Professor Batchelor was a supervisor the whole time. I got a lot of experience that day, which was really nice outside of clinical. Aside from that, I think peer leadership was also a place where I got to utilize previous knowledge that I've learned from other classes and definitely apply it to helping these nursing students. So this semester, I had the privilege of being a peer leadership student for 309, 311, and 320. So I'll start with 309. 309, I got to actually meet at the unit. They were on the 7K unit at Lehigh Valley, and it was just great helping them with just the basics. So things like introducing themselves to the nurse and to the patient, and just getting comfortable with touching patients to start doing head to toe assessments. And it was also really interesting to see how I've come so far from 311 to our nursing courses now, and seeing what they were worried about and how I was worried about the same things when I was in their steps. So that was also rewarding. And I also did 311. I did 2 311 labs. So they were both health assessment, and they both also dealt with head to toe assessments. So for the one, I remember the class needed help with cardiac sounds, as well as like where to place their stethoscopes to listen to cardiac sounds. So Strata let me share with them what I had learned when I was in that position, which is the ape to man, and I think that helped me a lot. So I shared that with the class. And the other 311 health assessment that I did, they were mostly asking me for advice for their overall practicum, the head to toe practicum video, or not video, but their live interaction that they had to do. So it was funny seeing how much it is, and you think it's so much, but in the moment, but then when you're done, you're like, it's a quick head to toe assessment. So it was rewarding being able to help the students with that. Objective number 2 is to apply the basic principles of ethics and management to meet the challenge of the ever-changing healthcare environment. So just recently this week, I got the privilege to shadow a nurse supervisor at Lehigh Valley, and I would say that this applies to this objective. I think probably the biggest responsibility of a nurse supervisor is dealing with staffing, and staffing is something that we've covered in our leadership course a lot. We've talked about how staffing can positively and negatively impact the work environment. It can make it a great place to work if you have lots of staff and lots of support, and it can also make it a very challenging place to work if there's no support. Then you're dealing with short staffing, you're dealing with heavier patient ratios and assignments and things of that nature, which can lead to burnout and stuff like that. So I actually got to witness how a nurse supervisor like staffs a unit, and how difficult that can be due to the current situation that we are in with COVID. It's hard to get people to work, especially when there's things like COVID, or aside from COVID, but there's other factors like call offs and things like that. So I got to see how she manages people that call off, and bringing in new people and float nurses and travel nurses, and just overall getting the unit staffed. And it gave me a newfound appreciation for what nurses supervisors do, because a lot of the times we don't see what they do, but it's obviously very important to keep the hospital running, and I really appreciate that. So objective number 3 is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So this was also really important to me, since I know Cedar Crest College is pretty much known for nursing and being a really good school of nursing. So I applied this to my clinicals, in terms of representing myself and my appearance. I always made sure that I dressed business casual. For my service leadership, I did this at a Feed the Children, so it was a pretty casual experience where you were kind of helping unbox things and like unpack canned goods to feed children. And I even then dressed business casually, and I had people ask me why I was dressed like that, and I told them, "Oh, I'm here for Cedar Crest College," which actually sparked interesting conversations. People would ask me about the School of Nursing, and it was great to be a representative for that. Aside from that, communicating through emails with our leadership mentors this semester, reaching out to them and making sure to be professional in these emails, introducing yourself. Hi, my name's Alyssa. I'm a senior nursing student. When can I meet with you? And finding a designated time to meet, as well as sending thank you emails, was very important. So I always made sure to send these thank you emails. And since for the most part we didn't really have an address to send cards, it was mostly emails. So what I did, I took it a step further and I actually would send like a picture of a thank you card in the email because I thought that that made it a little bit more personal. And so, yeah. Objective number 4 is to critically evaluate and disseminate current research related to the principles of leadership and the effects of the healthcare system. So, for this, I chose an article. The title of my article is The Relationship Between Nurse Managers' Leadership Style and Patients' Perception of the Quality of Care Provided by Nurses, which is kind of a mouthful. But the overall gist is that this is a cross sectional study that basically investigates whether nurses in leadership positions, if their leadership styles affect the work that nurses do in the clinical field. So, the results of the study, oh, and this was actually in terms of the work that they do was in terms of, say, for example, burnout or personal stressors. Like, does that come into play due to leadership styles? So the results of the study found that when nurses, that when they had a strong leadership, um, they reported higher satisfaction rates at their jobs, and in turn, patients actually reported that they received a higher quality of care by these nurses. So this just shows that there is a direct correlation. And I would actually apply this to what we've learned in class, especially Sullivan, chapter 8 talks about leadership and power. And we've always talked about important qualities of leaders, and it's very important for leaders to understand that they're influential to their staff and to have leadership qualities such as open communication, such as good, contact with people, open and honest contact, as well as problem solving skills, because that can go a long way. Um, Objective number 5 is to function as a competent patient advocate, a nurse advocate, and a change agent. So for this, I actually thought of Provision 3 of the ANA Code of Ethics, which I have. It is the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So when I think of this, I mostly applied it to terms of elderly patients. So I myself work as a home health aide, and I've experienced how it is important to be an advocate for elderly patients. So in terms of our leadership clinical, I saw this when I did my Meals on Wheels experience, which is basically an experience where um, we are given food to deliver to people who are less fortunate, and it was a probably the most rewarding experience that I've done in leadership thus far. I think it's amazing advocating for people that don't have food and getting them these meals and seeing the looks on their faces and the gratitude that they have towards us for helping them out. Um, I even delivered a birthday present to the one lady who had her food, and she told me that it was the only present she had gotten that day. And it just made me feel so much better to know that I helped her out. And also, aside from Meals on Wheels, I also saw this too. And when I visited Country Meadows, I shadowed the charge nurse. Her name was Emily Storm. And I saw how um, nurses, especially in nursing homes, basically get to know the patients very well, and they also work very closely with the interdisciplinary teams. So they know the patient best, and it's their job to be advocates for their patients, and I think that they do a very good job at that, and they know what the patient likes, know what they don't like, coping mechanisms and things of that nature that are very important, especially for elderly patients that do tend to be confused and things of that nature, since they can't advocate for themselves. So next I have objective number 6. Objective number 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and a contributing member of society. So I applied this objective probably to our continuing education experiences, specifically our Dine and Discuss events. So in our Dine and Discuss events, we met multiple speakers, and it was truly interesting to see how many of them emphasize the importance of furthering our career besides a bachelor's degree in nursing. A lot of these places talked about how most of the time the institution that you choose to work for, you should check to see like what they offer for you in terms of furthering your career, because that is important, and furthering your career can lead to further career growth and things of that nature that are very important. So um, it was interesting to think about. I know, at least myself, it's hard to think about going to school when you're still in school again, but it's something that I hadn't very much considered up until I've heard them talk about it. And actually, one of the nurses, her name was Kimberly Wrights. She said something that stuck with me as well, and she also talked about how where you first start is usually not where you end up, or where you think you're going to start is not where you end up, which I found was very kind. And like I would apply that to my own life as well, because I know I think I have an idea of where I want to end up, but in the end of the day, I really have no idea. But hopefully, I'll figure it out soon. Um, Objective number 7 is to recognize the role of nurses in policy making related to healthcare services at local, state, national, and global levels. So, one of my favorite parts of leadership that's been a really influential part has been our political leadership sessions. So I actually had the privilege of attending all of these, and I got to see all of the politicians. And I think that nurses should definitely be involved in politics, because nurses are affected by politics in some ways or others. There's always a correlation, and especially now because of COVID, politics in nursing are more connected than ever. So, for example, Representative Schlossberg, he came and talked to our class, and he talked about how for him it's very important that he supports things like mask mandates and CDC guidelines, and he's working very hard to promote those things. And it's great to know that you have somebody like that on our side looking out for us. So I really appreciated learning about what people are doing in politics to help nurses. And it was also nice being able to ask questions and kind of make issues aware to them that they may not know about. But for the most part, they were pretty aware of issues in healthcare. And it's just good to be able to bring that up and see if anything can be done about that, especially because most of these politicians have influence about over bills they can create or pass or block bills that can be influential to healthcare and healthcare practices. Next is objective 8 is to predict and describe potential ethical dilemmas within the clinical, organizational, and professional nursing practice. So for this one, I think of my experience with my advanced practice nurse, and this was in the IPCU. So this nurse was actually explaining to me about how there was an ethical situation sometime in her career where two staff nurses on the unit came to her and described how they were concerned that a nurse on the unit was maybe not wasting opioid medications properly. So this nurse investigated this incident, and as we've learned in class, substance abuse in nursing is something that's prevalent and something that can't be ignored and needs to be investigated. And luckily, that was definitely not the case. In this case, the nurse ended up being a new grad who was unaware of the proper procedure. And so I got to hear about how the nurse handled the situation. She had to properly educate the nurse and explain to her the proper procedure so that it doesn't happen again. So those were my objectives 1 through 8. Thank you so much for watching, and that pretty much concludes my reflection video.